Assalamualaikum and good morning to Madam Jasmine. My name is Seri Nursyahirah.
My name is Nurain Nadhirah binti Salleh. We are from the KM1A and currently studying at Polytechnic Nilai.
Our title today relates to the scientific knowledge of Cipa disease, which is very rarely explored or suffered by any person in this world. So Ain, can you share with us what is Cipa means?
What is a Cipa? Cipa is congenital insensitivity to pain with anhidrosis. It's a rare autosomal recessive disorder of the nervous system which prevents the feeling of pain or temperature and prevents a person from sweating. Cognitive disorders are commonly considered. Cipa is a fourth type of HSAN or hereditary sensory and autonomic neuropathy. Is also known as HSANID. How about signs and symptoms?
The signs and symptoms of Cipa or Cipa appear early, usually at birth or during infancy, but with careful medical attention, because that will affected individuals can live into adulthood. Infants may present with seizures related to hypothermia. They are unable to regulate their body temperature. Patients of Cipa or Cipa are unable to feel the pain and temperature. Lack of pain puts those with Cipa at a high risk for accidental self-mutilation. Corneal ulceration occurs due to lack of protective impulses. Meanwhile, joint and bone problems are common due to repeated injuries and wounds heal poorly. What is the causes? Is it because of our genetic?
Cipa is caused by mutation in the NTRK1 chain, which gives the body instruction to make a protein that is important for the development and survival of hive cells. I hear Cipa diagnosis are really no jokes. Can you elaborate about it?
There are not simple X-ray tests or blood tests that can identify Cipa. Some people who have Cipa have abnormally underdeveloped nerve and lack of sweat glands on a biopsy. The most definitive diagnostic test for Cipa is a genetic test, which can be done before birth or during childhood or adulthood. There is a known genetic abnormality that identifies Cipa, and it is called a human TRKA. TRKA or NTRKI gene located on chromosome 1. A genetic DNA test can identify an abnormality of the gene, confirming the diagnosis of Cipa. Do we have any cure or treatment that we can do for heal this disease?
There is still no cure for Cipa. Treatment is aimed at controlling body temperature, preventing self-injury, and treating orthopedic problems as soon as possible. It is very important to control the body temperature during surgery.
To conclude, This study shows that we should notice the combination of some different signs and symptoms to find this syndromic disease. This syndrome can be diagnosed by clinical and periclinical tests together, but it would be better to confirm by genetic tests. The diagnosis of this syndrome helps us to try for better quality of life for the patient and avoid unnecessary amputation. So without further ado, let's jump right into the question and answer session.
Can Cipa patient feel temperature shock?
We certain that an expert also can't make an official statement on that, because congenital insensitivity to pain with anhidrosis or CIPA or Cipa has two characteristic features. First, they have the inability to feel pain and temperature, and second is the decrease of absent sweating, or we call it anhidrosis. This condition is also known as hereditary sensory and autonomic neuropathy type 4.
So, Nursyahirah, how long can patient Cipa live?
Cipa is extremely dangerous, and in most cases the patient doesn't live over age of 25, I think. Although some of them can live a fairly normal life, they must constantly check for cuts, bruises, self-mutilation, and other possible unfelt injuries. So basically, the scientific themselves don't even know how long this Cipa patient can live. May you share with us who discovered this Cipa disease?
Cipa, or congenital insensitivity to pain with anhidrosis, is an extremely rare autosomal recessive disorder, initially described by Swanson in 1963. We report a 2.5-year-old boy with clinical features of Cipa as the first case in Iran.
These cases are very rare. So Ain, how many cases of Cipa that we have been collected until today?
Cipa is very rare disease. There are only around 60 documented cases in the United States and around 300 worldwide, since it is a genetic disease. Cipa is more likely to occur in homogeneous societies, while there may be very few reported cases. Many studies have been done on this individual.
Unfortunately, we have reached the end of our presentation. Last but not least, do care about the issues around you. Maybe you can be a helper for that. The most sincerely thank you for Madam Jasmine and dear viewers. Stay safe, stay at home. We need to survive this pandemic. So yeah, take care of yourself. Bye bye.
That's all from us. Thank you. Bye.